Welcome to Trifecta Collective, Finding the Root with Megan and Shannon, the podcast, where we dive deep into all things health and wellness to help you find health and healing inside and out for now and forever. Hello, and welcome to Trifecta Collective, Finding the Root with Megan and Shannon. I am Megan Abbott, owner and founder of the holistic health practice Trifecta Collective, and this is my co-host and head practitioner, Shannon Callery. Welcome to the podcast.
Hello, how are you doing?
Yeah, I'm doing pretty good. Today's topic is a really interesting one because it is very relevant for me at this moment, more specifically my partner, but working through this. So yeah, excited to dive in here and chat more about this. I know clients, we get a lot of questions about this, and even, potential clients who talk to people on consults, asking about antibiotic use and is it okay? Should they take it? When should they take it? Support during, support after, like what does this all look like? So we're going to dive into all of that today, and I'm just going to share a blanket disclaimer here right off the bat and say, please do not start, stop, change, switch, anything with any medications without first consulting your physician. Keep in mind, this is not designed to be medical advice, but more as, some things to think about and maybe some additional education so you can ask better questions to your provider. So just want to throw that out there. This is not a do or do not. Antibiotics have a time and a place. And we also need to understand, one, their limitations, two, when they may not be great, some kind of big red flags to look out for, and then how do we support the body, before, during, and after we do take antibiotics, because at some points in time, it may not really be an option other than you need to take them. So we want to talk about, if we do have to take them, because they do have a time and a place. Thank goodness we have antibiotics in Western medicine in certain instances. Yeah. But there are real consequences that can happen, and my partner is experiencing some of those currently. And so we're supporting his body the best we can, and want to share some of the things that come along with this.
Yeah, this is a topic that not only is it come up a lot within the last 2 months, which is why we chose to talk about it. There's lots of people that, this is so funny, even my dog, we had to consider putting him on antibiotics. This is just a very present thing right now. So that's why we want to talk about it. And there's also a lot of fear around it as well, being in the holistic health space. And I've been there. There's definitely still some fear I have around some of this stuff that I'm working through. But ultimately, like Megan said, there's a time and a place for antibiotics. So really, we just want to dive into how can we support the body a little bit more when we do have to take them, when might be a good time to take them, when isn't the best time to take them. So we're going to go into all that stuff here. And yeah, sometimes we got to take them. And we didn't even put this on our list here, but since it's coming up, I'm just going to start with this. There is a ton of fear around taking antibiotics. So right off the bat, if you are someone who has some type of emergency room situation, major infection going on, yeah, you got to get some relief. If there's a medical provider telling you, hey, antibiotics would be a good idea, that would be a pretty great time to take those antibiotics. If that is the case and you do have a lot of fear coming up, making sure you are adding something in some sort of mindfulness activity to help process some of that fear is going to be a good starting point if you do have to take antibiotics. And we have talked about nervous system regulation, mindfulness work in so many episodes. So I encourage you to go back and listen to some of those if you want to get really specific with it. But I would say that's also an important piece here.
Yeah, I mean, antibiotics, it can be life-saving. And so that's important to understand. In the case of my partner here, for us, and it was an immediate relief thing. His symptoms were bad enough. We ran blood work. We've seen multiple physicians at this point. And, I actually pushed for antibiotics, which is a weird thing to say. And at the same time, he was so uncomfortable and not sleeping and having this stuff going on that I was like, let's get on him. Like, worst case scenario, they don't work, but you have, looking at your lab work, we have some clear signs of an active bacterial infection going on.
Yes.
And while there are other things going on that I see coming up through the lab work, those are longer term things. Like, though I can support you. I can make the recommendations, and it's not going to give you immediate relief. So also understanding that, like, for we get this question a lot with SIBO. Like, hey, I've been diagnosed with SIBO. I
Yeah.
know it's not the root cause, or we share that, hey, like, this is not a root cause, and they have antibiotics on hand, or maybe they're already taking them, or the question is, do I take them? And for that, it's like, if you need some immediate relief, like, yeah, for sure. Go for it. Like, if you can't eat anything, if you are like so uncomfortably bloated, like, once again, it's gonna come back. The SIBO is gonna come back. It's not a long-term solution. And yeah, if you're super uncomfortable and need some immediate relief, like, go for it. It's okay. Like, we can support your body. And we can look at the bigger things going on and address those, but you can get immediate relief, which can go a really long way depending on the person and the severity of the symptoms that someone's experiencing.
Yeah, and oftentimes that if you're a person who is not taking like multiple rounds of antibiotics, which we'll get into that in a second here, if you're using it for immediate relief and you're also aware that hey, there's maybe something deeper going on in my body like SIBO, this is going to give me that immediate relief, but it's not going to actually fix it. That's also a good starting point to actually start to dive into like the root issue of the problem into in this whole other side of like the holistic health stuff and whatnot. So yeah, there's no shame in taking antibiotics to get immediate relief. That's totally necessary. Sometimes I actually went through a similar thing with my partner. Was it last? Wow, it was almost a year ago. Last winter, and this kind of ties into what I want to talk about here, the testing portion of this, because we can see bacterial patterns within blood work. And sometimes, we've talked about this before, not everyone knows how to read these patterns in blood work, specifically like when we're in a Western medicine office, that they're just not trained for that. It's nothing against them. They are just not trained to read these type of patterns. So for his case, like we were in there, he had tons of signs of like bacterial stuff going on and they weren't giving him antibiotics. He needed immediate relief. And we were looking at the blood work and I'm like, hey, there's like a very clear bacterial pattern here. So the testing piece is also important to it too. So if you're someone who maybe you're like in major pain, you have something going on, you go in, they don't give you antibiotics, like sometimes it's worth like going to get another opinion and just seeing like if that's the route that you want to go. Sometimes we need other opinions on things.
Yeah, exactly. And so when we look at bacterial patterns, really what we want is the CBC with differential. And, once again, like, this is like super fresh for me within like 8, 9 days at this point. This like just happened to us last week. We went to an urgent care and they were going to run some blood work. And I have a lot of experience in the Western medicine world, for the worst mostly. And so I was really specific about, hey, what test are you going to run? And the differential part of the CBC, which, by the way, they will not always run. A lot of times they may just run the CBC without the differential. Be sure to specify and ask. They're not going to get mad at you, by the way, if you just ask, like, hey, are you going to run the differential part of the CBC? And they're like, oh, yeah, we are going to do that. Or like, no, I wasn't planning on it. Be like, hey, can you? The difference in the chart, like the pricing for CBC versus the CBC with differential, is a couple dollars. So, whether you have insurance or not, well worth a couple extra dollars to get this information, because this is invaluable information. So on this differential part of the CBC, it's really the neutrophil marker that we are really looking at for bacterial patterns. And I am going to give you a range here. So if you're looking at it, it's going to come in one or two ways, whether it's going to be an absolute and or a percentage. It kind of depends on the lab, how the results are going to show here. So we're looking at like 50 or 60, 50 to 60%, if from a percentage standpoint, is our optimal range. And 3.2 is the upper limit of our absolute value. So, if we're seeing, things higher than that, we're really going to see a bacterial pattern. And so, like for my partner, we were saying like 70, 75% on that neutrophil marker, and then a 6.1 for the absolute, which is once again like a very clear indication of some bacterial stuff going on.
Yeah, that's pretty clear. And then of course we're gonna look at like, white blood cell count too. That's another thing. If that's trending super high, like the lymphocytes, and there's a handful of different immune markers here that we like to see and look at. But yeah, ask questions. There's nothing wrong with that. That's advocating for yourself. There maybe some practitioners don't love that. But again, like it doesn't really matter because you're allowed to ask whatever you want to ask. So, and it does go a long way too. Like, granted, if you're in an emergency situation and you're not someone who knows how to read blood work, you're listen to what they say because that's your only guidance. But yeah, if it's something that is taking longer to resolve and you want to get like a second opinion, that's kind of like where Megan and I come in. We have a lot of people that happens to, where they get sick and they take antibiotics for like months on end and things just aren't getting better. And that's when we see people like show up with their blood work and we're like, okay, let's find like the actual root issue here. We need a different set of eyes, reading it a different way to just find out what the actual root is.
Yeah, and also, if we're looking at the once again differential part of the CDC here, and actually I'm going to go back to white blood cell count here too because like super fresh. Have talked to multiple doctors at this point. So our range for white blood cell count is give or take 3.5 or 4 at the low end. And then 6 would be our upper range. And like here's the thing, and this is like a one, like I've had to do a lot of like breathing exercises and practice a lot of patience. Saying like, upper limit of white blood cell count is 10 typically, give or take, once again, depending on the lab. And if you're at like a 9, somewhere between like a 9 and a 10, and they say like, oh, you're fine, like dig a little deeper, maybe ask some more questions. Once again, this is where education really comes into play here of like, okay, you're almost at 10, almost at the upper limit of the lab range. Not great. The lab range is if you're close to either end of those ranges, you are out of the optimal range, 100%. I would say the exception would be cholesterol here, but outside of that, that's the biggest difference. The other thing that is a really common kind of, I don't want to say mistake, but education here as far as like bacterial versus viral patterns. If we look at viral patterns, we're looking once again at the differential part of the CDC. We want to look at the lymphocytes. So the lymphocytes is really indicative of what can be viral. We can also see some autoimmune patterns come up here. But our typical range for lymphocytes is going to be about 30 to 37%. We're looking at 2.1 as the upper higher end limit of that. And so if if that part is trending on the higher side, once again, we're looking at acute settings here. An antibiotic is probably not going to do very much because viruses don't respond to antibiotics. It's really bacterial issues alone that really respond to the bacterial side of things. Now, there are other things we can certainly implement, and there are a lot of natural antivirals. As someone with a history of EBV, like all that, I actually have L-lysine sitting on my desk here as we speak because I don't want to get sick. Anytime I'm around anyone who's sick, I always just like casually start taking that just as a prevention measure. I've been on that for like almost 2 weeks now, I think, just like a super low dose and just to make sure I don't have a viral flare going on here.
Yeah.
Because I don't want to get sick, and, with everything that I do, and I want to be just a partner while he's sick. So I don't want to get sick. So
Yeah.
that is a really good natural antiviral. There's a lot of other things here too, but it's also important to keep in mind like antibiotics, bacteria, viruses don't respond to antibiotics.
Mhm. And that's part of the general issue that we see as well with antibiotics being over prescribed, given out a little bit more easily than we would like to see, is sometimes we're not even, and I have had these experiences, I've talked to many other people who've had the same experience. Sometimes we're going in and they're not even doing testing. We're just immediately like, oh, like you're sick, here's an antibiotic. Well, if it's viral, guess what? It's not going to do anything. And it's actually going to do more harm because now you're killing off. The antibiotics don't choose whether they're taking bad bacteria or good bacteria. They go in and they wipe everything out. And again, sometimes we need that, but if we're dealing with a viral issue, that's going to be no help whatsoever. And it's actually going to harm us a little bit more just because it's taking away all of the good stuff in our gut. So that right there, speaking of red flags, is a big red flag. Like if you are going in somewhere with symptoms saying you're not feeling well and they're not running any testing at all and just immediately like, hey, here's this medication, here's this antibiotic, red flags should be going out all over the place because you need to actually know like what you're dealing with internally, especially before you take something like an antibiotic.
Yeah, exactly. And my once again, like my partner's had some negative side effects of being on this antibiotic, and so antibiotics can be very, very harsh. And so, like, while necessary in many cases, if we don't have to put our body through that because it's not a bacterial issue, we may want to like ask some more questions, ask for more testing. That once again, this is where education is really powerful in being able to advocate for yourself and being able to ask just some questions, even if you don't have full education, just asking more questions of like, hey, is this actually bacterial? Is this more viral? Like why, like what is the purpose of the antibiotics? And especially if you're coming at this from, like being nice and being curious as a starting point, that can go a long way. And I don't know about you, Shannon, but I know for me, whenever, once again, like, and I'm about to head into multiple other doctor's appointments here, like, I try to be quiet. Two, I try and be very respectful and just like really gently ask some questions until I start being dismissed. And then I get a little bit more aggressive in the advocating process. And I think that's important. I really don't think most doctors, PAs, NPs, like nurses are the unsung heroes of the entire Western medicine world, in my opinion. But like I don't think most of these people aren't coming in maliciously. Most of these people are just doing what they're trained to do. And unfortunately, Western medicine is not great at fixing and healing chronic issues. Like they're good at acute things, at emergent things. And we went to the ER and I had a conversation with this physician and, he's like, hey, look, like this is not my area of specialty. And if you were dying right now, like that is what I could help you with. Like, but this is not my super area of specialty, which while I did not agree with him on many things that we talked about, I did appreciate the fact that he was like, hey, like this is not my area of specialty. And I'm like, thank you for acknowledging that and still being open to having a conversation, which I know is not the case with all physicians because I've been there. I've fired many doctors
Yeah.
that were very dismissive, which obviously I'm sure you have too. And so I'm sure so many people can relate. But I
Uh-huh.
think coming in there from a perspective of like, hey, they're doing what they are trained to do and understanding that they're not trained to look at root causes. They're not trained to look at the bigger picture. They're trained to look very specifically at specific things. And hey, based on this lab test, based on your symptom, here is the prescription medication or procedure that can or may help with this. And that is really how Western medicine physicians largely are trained, and which can be fine. Once again, has a time and a place. And when it comes to chronic issues, this is why so many of us struggle and spend years and years and years in the Western medicine system, be just getting frustrated and not getting any real answers. And that's why, it can take like 8 to 15 different physicians to get diagnosed with an autoimmune condition, like all of these things. So I think that's important to understand, and just like come at these situations with some compassion and understanding, just because of their own limitations. And we have our own limitations too. And I, once again, I was like, I fully acknowledge that I am not a specialist in certain areas, specifically in acute situations. And I am going to ask some questions here, because there are some things that are coming up that I do understand and I have questions for you about.
Yeah. It is super important to know that, especially if you're someone who has seen like multiple doctors at this point, like trying to deal with specific issues. It's going to save you a lot of like stress and frustration if you just understand the fact that like, hey, this is how they are trained. This is what they are doing, instead of like almost getting that runaround. And honestly, that's why we're talking about this. That's why we do these podcast episodes, because we are truly trying to help people understand and educate them on like, hey, these are some of our different options out there. Like whatever resonates with you, that's awesome. But just like sharing the educational piece and being informed so you can make those decisions on your own. And if you do have a doctor or a practitioner that you're seeing who you feel dismissed by, who shuts you down when you ask questions, that alone is a red flag. Like, I get it. They're, like we just said, they're not trained on some of this stuff, but at the same time, they are still a doctor. They still have to have some compassion and understanding and be willing to support you and listen to you and answer your questions. If you're just feeling like completely shut down and dismissed by someone, that's probably not the person that you should be working with when it comes to your health.
Yeah, and I think that's really important to understand. And it like, look, it's okay to fire doctors. Like I have fired many, many doctors in a variety of specialties, even in the Western medicine field and the
And the
holistic field,
holistic,
and yeah, like in both areas. And it's okay. And like, especially like for me and finding my own answers, and I know so many people experience this, of be like, hey, I think it's maybe your anxiety or your depression, and maybe it's just in your head. Like, yes, your mental health can play a role. And if you're in pain, if you're in discomfort for even a short period of time, like, that's going to take a toll on your mental and emotional health. So that's also important to understand. And yeah, like asking for tests. Like I had a doctor, and this was in very early stages of, and now we're just getting off topic here, but it's okay. Uh, yeah, I had this physician, a primary care physician, who I'm not a review person, especially negative reviews. Like, I really believe in giving everyone a chance. And I wrote the most scathing review of this woman after multiple instances. My hair was falling out. I had no eyebrows. I was gaining weight unexpectedly. I was tired all of the time, and I couldn't sleep. I was cold. Like, my hands and feet were always cold. And this physician would not run a single thyroid marker for me. And I was just like, can't, can you just run like anything? Like, just double check on my thyroid, because I've got all of these symptoms. And she said, absolutely not. And then, 2 months later, I was diagnosed with hyperthyroid or hypothyroidism. And then, shortly after that, Hashimoto's. So, we
that's
know our body's
crazy.
best. Yeah. And then she also, what really made me fire her, that was a piece of it. But the big piece was she had no bedside manner. She has no business being a primary care provider. She was asking me questions and definitely digging into the like anxiety, depression kind of piece of like, are you married? Are you super close with your family? Like, do you have like a whole bunch of friends? And, I was in a serious relationship. I was living with my partner at the time. We were not married, but we were living together. My family and I are not close. We haven't been for my mental and emotional health and my healing. And I have a group of friends. I don't have a large group of friends. I'm also like not that person that has ever had like a super big. I like a few really good friends. I don't like a big group of just like casual friends. And she's like, "Oh, how sad." And yeah, I just, I mean, it's like everything in me to like not hit her. And I'm also not a violent or angry person. But I mean, I was like, we are done. After
Oh
that, I
my
just like
God.
could not handle her. So it is okay to fire people and also give them a chance. Like it's
Yeah.
okay.
I'm glad that we're talking about this because believe it or not, there are a lot of people that I know personally who repeatedly go back to the same doctors when they are being treated this way. And it's because like I feel like when we grew up or what we learned, especially for like my parents' generation, it was like you do what the doctor says, you do what you're told by the doctor, you don't question them, like you don't know anything, like don't listen to yourself at all. It is solely like we do what they say. And now that is clearly shifting. But yeah, it's like it is mind blowing. Like that's not even any way to like treat a person, let alone talk to them. So no, they shouldn't have been in that position at all. And I hear that quite often. Yeah, I a similar experience when I moved to Houston, found a new gynecologist, saw him one time, asked him if they would run testing, which I hadn't run like thyroid hormone testing in like 3 years at that point. And she was like, "Are your periods normal?" And I said, "Yeah." She was like, "Well, then you don't need it." And I was like, "Okay, I'm never coming back to see you again." So just like simple things like that. And not approaching it with, which this is a learned thing, trying to let go of some of the trauma around it potentially, but kind of approaching it with like a lighter manner, like a better understanding again of like, hey, this is what they can do and understand, this is what they can't do, also helps with the process too. Because I can remember a time where I would have been like so upset. I probably would have been pissed about it for like 2 or 3 weeks. It would have got me really stressed out. I literally walked out of the office like laughing because I was like, this is just so stupid. So, how we handle it too, again, just being educated about it and understanding like what they can do and what they can do, it can really help with the process.
Yeah, and just like one little other thing to kind of wrap up this part of the conversation, but like if we think about it, there are great med schools and there are maybe not as good med schools. And sometimes people finish first and sometimes people finish last. And I think that's important to understand. I also think it's important to understand, the type of training, maybe the experience. A lot of people go into medicine because they love science and they love that side of things. And maybe their interpersonal skills aren't the best. Uh, Not an excuse to treat someone poorly, by the way, but just once again, coming in from understanding. And so all of these things can play a role. I also think, some physicians are, super interested in emerging science and staying up to date on new things and are genuinely curious types of people. And some aren't. And, once again, I don't think there's a right or wrong, but once again, just like coming at this from an importance thing. And I can say the same thing from like holistic health providers, like not necessarily that we all go to like a traditional type of school for this kind of education, but some practitioners are more curious than others, and some people have, like, nope, if you have SIBO, you come in, you do this exact protocol, you eat this exact way, you do this for this amount of time, and then you are fixed. Versus, practitioners like us, where we're like, oh, okay, well, let's look at your testing. What do we got for your symptoms? What do we think is going on? Let's look at the whole picture. How long has this been going on? What started this? Okay, well, let's look at nutrition and lifestyle and movement. Like, let's look at your trauma history. Like, are you super stressed? Like, and just like, and we continue that kind of curiosity throughout our entire process to figure out all of the big root causes and really help people heal the most complete and holistic kind of way. And not all practitioners are like that. So it's just like when you're searching for someone, whether that's a physician or a therapist, I also fired eight physical therapists during my journey. And I fired a lot of providers, and for good, very, very good reasons, all of them. And so I think it's just like important when you're looking to work with someone, ask questions, and get curious about how they work, and also maybe like clear on what do you want? Do you want like a one size fits all? Do you want something really customized? Do you want someone who's very empathetic? Do you want someone who's very like straightforward and direct? Like, just like think about all of these things, and I that's gonna help you find the best person for you and whatever you're looking for.
Yeah, and also like what are you willing to do? Because the deeper rooted healing is going to take more time. It's often like a long-term journey, not necessarily for like the supplemental detoxing part, but when you really get into like the trauma stuff and the nervous system regulation, those are things that we leave clients in there when we're done. They're continuing to do those things. They're continuing to dive into that stuff. Whereas, like, if you just like, if you really don't want to do that, you're not interested, like, you want something short term, then yeah, that's also going to help you pick, like, who do I want to work with here? But we could go on a long time about this. But yeah, so just to kind of reel it back in here, we haven't really talked yet about, we briefly touched on using like multiple rounds of antibiotics and whatnot, but we didn't really dive into what else can be going on if that's the case. So again, we see this a lot. I've experienced that personally. I'm sure Megan, you did at some point as well too. And yeah, for me, it was the SIBO thing. At certain times, I think they were just giving me antibiotics because they straight up could not figure out what was going on. And other times when I did get diagnosed with SIBO, same thing with antibiotics, acne, all this stuff, constantly taking antibiotics. Completely wiped out my gut, never got to the main issue. And typically what we see underneath this stuff is going to be things like parasites, maybe mold toxicity, maybe you have some viral stuff going on, maybe you have some really deep-rooted trauma stuff going on along with all these other things. Typically, if you are taking multiple rounds, there's always something deeper going on. Like if you're not doing a short dose of antibiotics and feeling like good after, feeling back to normal, there's something else going on.
Yeah, there's really not a lot of reasons to have to go on multiple rounds of antibiotics. Especially, I talked to someone not too long ago, and she had been on 4 rounds of antibiotics in like 8 or 9 months. And the most recent one was a 21-day cycle of antibiotics. And I was so blown away by that. Like, I didn't even know that was a thing. 21 days. Like, gosh, that is so hard on the body. And she was experiencing that and was not getting a lot of relief, with these things. In which case, once again, like Western medicine has its limits. And, if we're going on 2, 3+ rounds of antibiotics within just a few months, there's absolutely something bigger going on that we need to look at the bigger picture. And in which case, Western medicine, has some more questions. They will probably have some limitations on what they're able to do, and it may be worthwhile to take a deeper look on the more holistic side of things, because there's something bigger going on. And yeah, the only other thing I'd kind of add on to your list, Shannon, is like heavy metals,
Oh
environmental
yeah.
toxins, like toxin overload in general. Really big. We can see chronic issues like Lyme, co-infections of Lyme, uh, in which case, often that is also not coming alone, either. So that's important to understand. I also think it's really important to understand. I just had this conversation yesterday with someone, you know, if we're looking at like all of these specifically like gut issues, I'll also say maybe like some inflammatory issues in there. And if you're going on multiple rounds of antibiotics and then you start having all these gut issues, PPIs are a next like really big thing that often many people are put on. And look, like you're killing everything good and bad when it comes to antibiotics, which once again, like there's a time and a place for this. But now if we're also like having continued symptoms, we're going on multiple rounds of antibiotics, and then we're going on things like PPIs. Man, I told them straight up, I was like, look, you probably have bacteria, yeast, fungus, and parasites, like all of it growing in your gut at this point because you've been on multiple rounds of antibiotics over the course of 7 years. You've been on PPIs for a good portion of that time. Like, yeah, I haven't even seen your labs yet, and I can almost guarantee you got it all because, yeah, I mean, you're missing all of the protection that's coming along with the gut support, and most providers are not recommending a probiotic, post antibiotic use, which we will get into here and how to support your body. In
Yeah.
which case, you're leaving your gut super susceptible to overgrowth issues long term. The other conversation I have a lot with people, and I talked about this in my gut masterclass, which you can still get access to, by the way. We have a new free resource page that's like really incredible. Our VA set this up, and it was actually her idea to put this together. We'll put a link down in the show notes here, but it's free resources, and we've categorized things by topic. We have a whole section on gut health and podcast episodes and master classes and carousels and all kinds of stuff for each topic. We have 10 different topics, just by the way. So we like really broke it down, and we're continuing to add things as we go. We also have all of our testimonials on this page. So go check it out. It's completely free, by the way, again. But yeah, in this masterclass, I talked about just like the stress bucket and stressors that come into play. And, one of the things that often we don't think about as a big stressor for the body is multiple rounds of antibiotics, especially without care. And I know, like, for, probably Shannon, you too, like we're about the same age, like growing up, you're sick, you go to the doctor, antibiotic. You're sick, you come in with a cold, a sinus infection, they probably aren't testing, antibiotic, antibiotic, antibiotic.
Yeah.
And that's just what it is. And that is very, very, very stressful on the body. And so I think that's important to understand too, that when we're looking at the stress on the body, like overall stress, like the stress bucket that we often talk about, antibiotic use, frequent antibiotic use, past or current, plays a big role in this.
Mm-hmm. Yeah. And before we get into the probiotic part, I feel like it makes more sense to bring up the binder piece to this. So when we're taking antibiotics, what's happening is like we're killing everything off. Even if there is bad bacteria there, we're killing it off. So if we're not taking something to bind it up, especially if we are already struggling with like a congested liver, constipation, like our drainage pathways aren't open, these things are going to continue to circle back into our system. So it's extremely important, and no doctor would recommend to take a binder with an antibiotic, again, because it's just not something that they're trained on. But it's the same thing as doing like, not the same thing, but doing detox work with herbs and whatnot. When we're killing something off in the body, we have to be taking something to bind that up. So very, very important to take a binder if you are taking antibiotics. And you can get something very simple like a charcoal binder, and that's going to be better than taking nothing at all. Is it the same as, some of these like Cellcore products that we use? Not necessarily, but everyone has a lot easier access to like a charcoal binder, and it can be very, very beneficial while you're working on actively killing off a bacterial infection in the body.
Yeah, exactly. And something that's really important here is if you are going to take a non-selective binder like a charcoal, clay, chlorella, zeolite, I think those are all the big ones. Make sure to take these on empty away from everything. They are non-selective binders, meaning they bind up anything and everything they come into contact with. And this includes food, medication, supplements, nutrients, anything that, anything else that we're putting in the body. So it is really important to give some space between the binder, those types of binders, and anything else that you're ingesting, food, supplement, medication, anything like that.
Yeah. And then, of course, like we want to make sure that we're going to the bathroom. I mean, we hear both things with antibiotics. Like some people get very loose stools, other people go the other way and they're getting constipated. And if you tend to lean more towards constipation, you may want to consider adding something in just to help support bowel movements if you do have to take antibiotics. There's something called Smooth Moves Tea, which we really love. If you need something very quick and in a pinch, like magnesium citrate, certainly not our favorite, but it does work for a couple days. Doing something even like Epsom salt baths, like anything that we can do to help support the liver, to help support the colon and emptying out. That's really important during this as well, because again, we want to make sure this stuff is actually leaving the body when we're killing it off.
Yeah, castor oil packs, another really good one, great for the liver. Also, can be for some can be supportive of helping bowel movements move. So that's a really good option. And just like liver support in general goes a really, really long way. So once again, like if you're killing things, they can release other things into the body. And making sure that things aren't getting stuck, that our body is well supported, the liver supporting piece, whether that's through lifestyle, whether that's through supplementation, even foods that are supportive of the liver, like all of that can go a really long way. So picking, it doesn't have to be crazy, dry brushing, rebounding. Anyone can do rebounding. Lymphatic drainage massages, like self massages. There's plenty of YouTube videos on this. Like there's a lot of different options there, but adding in some sort of liver support can also go really, really, really long way.
Yeah, and it's something that it's pretty accessible to. Like if you do have to get it in a pinch, like run to the store, grab some Epsom salt, or like Megan was saying, plenty of these things you can YouTube and just like do with your actual hands, like jumping up and down, help support drainage. There's a lot of easy things we can do here. And then of course, if you are sick and having to take antibiotics, prioritizing rest is also going to be really important because, we did a whole episode on sleep. Lots of things happen in the body while we're sleeping. We're working on draining, processing, cells are regenerating, and so many things happen while we're sleeping. So it's very, very important to, like, if that's the case, try and give yourself a little bit of extra space for rest, drinking plenty of water, because that's also going to help some of those toxins flow out as well.
Yeah, and if you're going the opposite way on the antibiotics, you're having like a lot of like urgent bowel movements, loose stool, quite a few options here. Typically we're not going to recommend a probiotic until after you're done with the antibiotic use. This would probably be one of the exceptions. And Megaspore Biotic would be our recommendation here if you are going to take a probiotic while on antibiotics. It does need to be taken. Usually they say like about a 2 hour window away from antibiotics is when you want to take a probiotic if you are going to take one. It seems to be pretty clear from research that there's not huge benefits to taking probiotics while still on the antibiotics. Now, post antibiotic use, way different story here, and we'll talk about that. But the Megaspore can, I will say, like be a little constipating. But if you're going the opposite way, it can help kind of solidify things and help with some of the urgency and the looseness of that. You could also add in like a bulking agent, something like a psyllium husk is pretty accessible, like some sort of bulking agent that can be helpful and help form the stools a little bit more. If you are tending that way, be sure to drink plenty of water because you are losing a lot of water. Making sure you're getting electrolytes too is really important.
Yes, that was excuse me, going to be the other thing that I said is if you are having loose stools, definitely want to focus on those electrolytes. And you can do something as simple too as like putting a pinch of sea salt in your water. Just like make sure you're getting some extra in because you're losing it. So you're definitely going to need it. But yeah, the Megaspore is, if you have to take antibiotics and you need something else, that would be the one that we would recommend. Rebuilding, what we like to call it, after any type of killing, antibiotics or detox work is such a crucial piece. Like, this is the part that cannot be missed because it's going to give you back all the good stuff and get your body in a good spot so you don't go back to where you started from. We've experienced this. We see it time and time again, especially with antibiotics, because it's just not a common thing that doctors are talking about. And even in the holistic space, there's plenty of killing protocols that people do without doing any of the rebuilding, the putting the good stuff back in at the end. So realistically, if you do take antibiotics, adding in a good probiotic is very important. So there's one that we like. These are from Microbiome Labs is like the name. We tend to like their products when it comes to rebuilding the gut. They have something called Restore Flora. Restore Flora. Is it Restore Flora or Restore
Restore
Flora?
flora. Yeah.
That's what it is. Restore Flora, PD, and just regular Restore Flora. Those are two products that we like. There's one different strain in the PD, and that one in particular is made actually, I believe they came out with that formula to be taken after a round of antibiotics. So that's a really great one. But you also want to add in, if you can, some sort of fiber of some sort, whether that's like a powder form, making sure you're increasing like the amount of fiber in your dietary intake, because we need something for these probiotics to actually bind to. We also like a supplement called Mega Pre from the same company. It's a prebiotic, so we're just like really trying to get in there well-rounded and replenish the gut.
Yeah, and I think it's important to understand. So the probiotic is helping put the good stuff back in there. However, what's almost just as important, if not a little bit more important, is feeding the good stuff. If you want to feed it and help it grow, you should not have to be on a probiotic forever. So, incorporating some sort of probiotic, and then once again, like just as important, if not more important, is some sort of prebiotic, whether that's a capsule, whether that's a fiber, especially if you can find like a fiber blend. That's really good. Our favorite one was unfortunately discontinued a while ago. Um,
Yeah.
we have other options, not quite as good in my opinion, but they're still good. Once again, like these are all helping and designed to feed the good stuff because once again, like that's almost more important. And there's plenty of prebiotic foods too, by the way. If you do a quick like Google search, you'll have a whole list of prebiotic type foods. But it's really important to feed all the good stuff. The other thing I did want to mention that if you do take around the antibiotics and you already have a lot of histamine type issues, a lot of mast cell issues, sometimes like regular probiotics don't feel great and can exacerbate the histamine issues. There is a product from Seeking Health, and I'm probably going to butcher the name because I always forget exactly what it's called, but it's Probiota Hist X, I think, is the correct name of it. And what it is it's a good probiotic, but it doesn't have some of the histamine producing strands of probiotic. So that's important to understand. The other thing I wanted to mention about probiotics, quality matters. And just because something is refrigerated and expensive does not mean it's good. Because what's really important to understand is our gut, our technical gut, is in our large intestine, which means this probiotic has to be swallowed or drank or however you're taking this probiotic has to withstand high levels of stomach acid and all of your other digestive enzymes and travel and make it all the way to the large intestine. If it can't survive in the air of a room temperature room, is it really going to survive high stomach acid? Just something, a question to ask. And this is where doing your research and looking at third-party studies for a lot of these probiotics goes a really long way. I'll also say, most of the probiotics, as well as like we've mentioned this before, but most supplements that you find at a generic grocery store, drugstore, or even a lot of health food stores, just by the way, especially the big commercial ones,
Yeah.
probably not the best quality. Also, just be very mindful of sellers on Amazon. I know there's like I've seen some other big stuff come up here recently about, like third-party sellers and knockoffs and things like that. So if you are going to buy on Amazon, be sure it's directly from the seller, the direct company. If you're going to buy like one of the ones that you recommended, like from Microbiome Labs, like make sure the seller on Amazon is Microbiome Labs and not some third party, because there's no quality control. If you can get it from like a full script or some other site, usually that's going to be a little bit better, and there is some quality control there. Which is one of the big reasons why we use Full Script, which is a wholesale supplement distributor, as well as many, many, many other types of practitioners.
Yeah, that I saw everything coming up again. Actually, Cellcore had some stuff. Did you that you saw
Mhm.
that? Yeah. Yeah, you really got to be careful. And that actually just happened to me. I was just doing some heavy metal detox work and looking for to get my Restore Flora PD, and I wanted to get it on Amazon because I wanted it quickly. And I went on there and I realized I couldn't find one from a direct seller. So you really have to look at that stuff because you just don't know what you're getting if you're buying from random people. I've heard horror stories of the bottle being empty, the seal being not on there, and who knows what they replaced it with. So yeah, very, very important to look at that. And all in all, I mean, I'm trying to think of some of the big brands that we like hands down, Microbiome Labs. I do really, really like their products and stand by them. We use them a lot. I'm sure Seeking Health, besides the one that you just mentioned, they would have some good stuff as far as like probiotics. God, what are some other? Oh, Biotics. I think they also have a pretty decent one as well. Those are the big three brands that are sticking out to me. But yeah, unfortunately, it's tough. Like anything that you get at your regular, like down the street pharmacy, the probiotics just aren't going to be that great. And same thing for the refrigerated ones. Like something to think about that if they need to be refrigerated, they're probably not going to make it all into your system and actually do the job. And some of those probiotics can get pretty expensive.
Yeah, and and there's different versions. I'll throw
Yeah.
Designs for Health in there. Like
Oh,
generally
yes.
speaking, they're pretty, good, high quality type of brand, and they have some different probiotic options. Yeah, Microbiome Labs is one of the best when it comes to like rebuilding the gut. Their
Yeah.
products, just by and large, are super good. So once again, like we're not loyal to any one brand. We like certain brands for certain things. And once again, like Microbiome Labs is one of the brands that we really like for like gut rebuilding. Even Designs for Health. I mean, they make GI Revive. So they
Oh,
they have
yeah.
some really really good stuff too. So
Yeah.
yeah, just things to think about. And I even, I've worked with a few clients who have spent a lot of time with their GI doctors, and these GI doctors, at least the couple people that I have experience with, yeah, all of their GI doctors recommended a very expensive, like $150, um, need to be refrigerated probiotic that when I looked at it and looked at all the research, and I've looked at a few brands here, like they're complete garbage. So, really just keep that in mind. Like, physicians are not largely trained in supplements and looking at quality of the supplements and things like that. So once again, like just something to keep in mind, that if your physician recommends a supplement, not necessarily bad, and probably worthwhile to just do a little bit of your own research too, and just double check. Because once again, like that's not their area of expertise. Like nutrition is not their area of expertise.
Yeah.
Movement, not their area of expertise. So just some things to think about.
Yeah. Yeah, and ultimately again, like if you do have to take antibiotics and you are nervous about it, just know that there all the stuff that we talked about is different ways that you can support your body during and certainly after as well. It's not going to be the end of the world. Like sometimes we just got to do what we got to do, but again, like red flags pop up when we keep being prescribed antibiotics and taking them over and over and we're not getting anywhere. So, yeah, hopefully this helps with taking care of your body if you do have to take antibiotics.
Yeah, and this is a little off topic, but I think this is also really important to understand. And we are working, just this mini announcement, on getting some special guests in some very specific topics. And
Yes.
one of the ones, and this is something we do see quite a bit, is like infections in your mouth, especially if you have root canals. Uh, that's like the number one thing. Like I don't know if I've ever come across someone that has gone to a biological dentist with a previous root canal that it didn't have an infection in it. Something to keep in mind that like if you're getting dental work done, really, really be careful. And once again, like antibiotics can be really good, but sometimes when it comes to your mouth, teeth, and gum area, some of these infections can be pretty sneaky. And it may not be really visible. It may need to, as much as it hurt, like I like cringe. I really don't like the dentist personally. But like digging a little bit deeper into understanding, like, do you have like cavities, infections, like things going on underneath root canals or crowns or things like that. Even like I've seen there's a couple like holistic biological dentists that I follow of like, and now I get really scared of like and I have to be very careful. But like wisdom teeth, like when you get your wisdom teeth out, especially if you didn't need it, like the pockets can form like infections and abscess in there. That can only be found through x-rays, which I'm also like not the biggest fan of, but they have value too.
Mine got infected.
Yeah.
I know what that's all. I know all too much about that.
Yeah. Yeah. So, just some other things to kind of keep in mind. Like, if you do have chronic infections, like there's something bigger going on, and there's a lot of things that we can look at. And oral health is a really big one. And if you have, I mean, keep in mind, let's say you have an infection under a root canal in your mouth, like every time you swallow, like you're getting some of that like into the rest of your body. Same thing, like if you have a lot of gut issues, like that translates to your oral health as well. And we've mentioned that a little bit before, but vice versa too. So, if you've had a lot of dental work done, if it's possible for you to see a biological dentist and maybe even just get like a basic exam to check on some of these things, like that can also go a long way.
Yeah, and again, like if something pops up where you do have an infection and you do have to have like the root canal removed and get everything cleared out, like this may be a time that you consider taking the antibiotics because I guarantee they're going to recommend them just to make sure nothing like that spreads. I mean, think about where that's located. Like our brain is right here. It's very easy for infections to spread. And then certainly, if that is the case, if you do have some sort of infection going on in your mouth that requires antibiotics, absolutely adding in liver support during this. There's a specific supplement called Tudka by Cellcore that helps with like brain drainage, adding something in like that, just like making sure we're not risking this infection spreading anywhere just because it is so close to our brain and whatnot. So yeah, that would be a great time to just take the antibiotics.
Yeah, for sure. And then also make sure it's like really properly addressed and taken
Yes.
care of. The other thing that's like a little bit more relevant for me, just kind of as we're wrapping up here, is like ear infections, and I've seen that I've actually had a lot of this come up for people post COVID or COVID like issues, and I think it's important to understand like there's a couple things here. One, if it's really bad, once again, take the antibiotic. Like, give yourself relief. It's okay. Like, no judgment here. And there's also some other things that can be really valuable to understand about like the ears and just like ear infections. The first one is when we do have a lot of brain drainage, sometimes things can get stuck or start to come out in different ways, and that can be in the ears. We do see this with some mold clients, I'd say more often than other types of clients that we work with. And sometimes this can be like your ears are just kind of leaking or they feel like really wet, or it can actually be like ear infection. So once again, Tedka is a really good product, specifically the one from Cellcore. It is different than the other ones. We've tested this many times with a lot of different case studies, and the one from Cellcore is by far different and the strongest, and in our idea the best. Therefore, not appropriate for everyone, just by the way, because it is super strong.
Yeah.
But that can be really valuable to help some of that drainage going on. Once again, like some lymphatic work, craniosacral massage. But there are also like mullein garlic oil drops that you can put
Yes.
in your ears that I used to be very, very prone to ear infections, and that is something that I started having on hand. And at the first sign of like ear irritation, I don't get them anymore. Just by the way, I also like don't get a lot of sinus infections anymore, and I used to. And that goes to different like biofilms and other bigger things going on. Just by the way, so if that's like you're super prone to this, like something to think about. We don't specialize in kids, so don't apply this to your children right off the bat.
Yeah.
I'm not totally sure because we do not work with kids here, young kids. But putting those drops in your ear at the first sign of like just kind of some discomfort, that can go a really, really long way. Herb Farm has a great one.
Oh,
Once
sure.
again, you can get it on Amazon. Make sure it's from the actual seller. And it's pretty inexpensive.
Yeah, that's such a good resource. I love those garlic mullein drops. I do have a friend who uses them with her younger children and sees good results, if that means anything to anyone. But yeah, we haven't tested that with kids ourselves. And I have had a couple clients use those just during like the detox work when stuff flared up. Super helpful, an easier thing to do than, or less disrupting than having to take antibiotics. So yeah, that's a really good resource to have.
Yeah. And just because you brought up your dog here before, like there are plenty of probiotics for animals too, and there's a lot of really really good ones. Like when I had my dog, he had ended up having some like significant GI stuff going on, that eventually did resolve, but I ended up putting him on a probiotic.
Okay.
And that seems to really go a long way. It was actually one that Shannon recommended to me. And yeah, I mean, really inexpensive. It was like $20 for something that lasted, I think the bottle lasted like 4 or 5 months.
Yeah.
For like a medium-sized dog who's about 30 pounds. So,
Yeah.
that's another just like good resource that if you do have to put like a pet on an antibiotic, once again, like not necessarily a bad thing if it's recurrent, is something to think about, but a pro and or prebiotic is probably a good idea after too.
Yeah, and actually, the brand that we love for this, the Microbiome Labs, they came out with a dog supplement. Yeah, it's
Oh,
called Phytospore, and it's just like a brown label. Same, pretty sure it's like the same thing as Megaspore, but just labeled different and maybe tweaked it a little bit. But I had used that for my dog when he got like his bacterial thing going on. And within a week, we also used like some wipes on his face, some apple cider vinegar stuff, and really, really helps. So yeah, that brand also makes a dog one now.
amazing. Well, we know it's good
Yeah.
quality too because we trust that
Yes.
brand, and so yeah, that's amazing.
Yeah.
So yeah, just a variety of resources there for you.
Yeah.
So, just like one last thing I want to throw out here is, especially for your gut stuff, if you were consistently needing antibiotics, once again, there's a bigger root causes going on. The other thing to really think about here that once again, like, even if you do like a rebuild, probiotics, prebiotics, like all that kind of stuff, the other thing to really think about is looking at the upper GI. And looking at protective mechanisms as to why and how bacterial overgrowths or bacterial infections happen in the gut. Because our body, once again, like our body has checks and balances for everything. And if things kind of go wrong, something also went wrong. Like, and finding, once again, this is where like our curiosity really comes into play and like digging and asking questions and digging deeper of like, okay, but what went wrong? And usually that's not a simple answer. It's many things. And one of the big things that when we go into a rebuilding protocol with a client after we've done some big gut work, is look at that. And so, we'll usually the biggest thing we look at is stomach acid production. Making sure that we have enough stomach acid to break down our food properly, because that's a huge protectant from all kinds of gut overgrowth issues. But also then looking at, like pancreatic enzymes, some other digestive enzymes like bile flow, bile duct health. Like if you don't have a gallbladder, you've got to be on ox bile. Like different things like that. So making sure that some of these protective mechanisms and the nervous system regulation plays a huge role here too. So just awesome things to think about here when we're looking at this.
Yeah. And I would even go as far as saying too, like if you do have to take antibiotics, it might not be a bad idea to add in some sort of HCl supplement, whether that's like, using apple cider vinegar for a couple days mixed with some water, just like something to help replenish and protect your gut while you're taking that. And then certainly during the rebuilding phase, that might not be a bad idea as well.
Yeah, yeah, for sure. So awesome. That is our take on antibiotics. And hopefully just once again, like one of the biggest takeaways I think here is just like an education, just like educate and equip yourself with information so that you can better advocate for yourself if you are put in this situation, whether it's more chronic or emergent, or urgent, things like that. Like it does make a difference. And just like asking questions and making sure that your body is supported. So you are your only person living in your body and you know your body best. So ask questions, dig a little bit deeper. It's only going to help you out and help you heal better, faster, longer.
Okay.
So thank you for listening. Thank you for joining. As always, please like, subscribe, follow. If all of this resonates here with you, 5-star reviews really, really, really mean a lot to us, and are very, very much appreciated. And thank you for listening, and we'll see you next time.
Yeah. Bye, everyone. Thanks for listening.